First, let's talk about the transport of gametes. After ovulation, the ovum is picked up by the fimbria of the fallopian tube and remains in the ampulla, where fertilization occurs. Sperm travel from the vagina through the cervix and uterus to the fallopian tube. In the female reproductive tract, sperm undergo capacitation, a 7-hour process that prepares them for the acrosome reaction. When sperm bind to the zona pellucida of the oocyte, enzymes like acrosin are released, digesting the zona and allowing sperm to penetrate. Finally, the sperm and oocyte membranes fuse, allowing the sperm nucleus to enter the oocyte cytoplasm. Ovulation is the process in which a mature egg is released from the ovary, typically occurring once per menstrual cycle. This process is driven by a complex interplay of hormones where the cycle begins with the follicular phase, where rising levels of follicle-stimulating hormone FSH stimulate the growth of ovarian follicles. As the follicles mature, they secrete increasing amounts of estrogen, which in turn triggers a surge in luteinizing hormone LH. This LH surge causes the dominant follicle to rupture and release the egg into the fallopian tube, where it can be fertilized by sperm. The remnant of the follicle transforms into the corpus luteum, which secretes progesterone to prepare the uterine lining for a potential pregnancy. If fertilization does not occur, the corpus luteum degrades, leading to a decrease in progesterone and the onset of menstruation. Mr. Harris has a BMI over 30, indicating obesity, which can lead to hormonal imbalances, reduced levels of certain fatty acids in sperm, and affect sperm production and function. He also suffers from erectile dysfunction, which may be caused by factors such as prostate issues, type 2 diabetes, hypertension, vascular disease, high cholesterol, low HDL, or depression.
Obesity can also lead to low sperm volume and count due to hormonal imbalances, excess estrogen, and reduced testosterone levels. Excess fat in the hips, belly, and scrotum area can elevate temperature, affecting sperm production and seminal fluid volume.
To improve his reproductive health, Mr. Harris should adopt a healthy lifestyle, exercise regularly, eat nutritious meals, quit smoking, limit alcohol intake, manage stress, and take medications as needed to balance hormones and improve sperm quality and quantity. He also could take PDE5 inhibitors to enhance blood flow to the penis to addressing his erectile dysfunction issue. Mrs. Alia's menstrual cycle is irregular, making ovulation difficult to predict. It may also indicate underlying hormonal abnormalities. Mrs. Alia can overcome this condition by using an ovulation prediction kit, monitoring her basal body temperature, and measuring her cervical mucus levels. Mrs. Alia may utilize this technique to pinpoint ovulation and improve her timing during intercourse. Aside from that, Mrs. Alia has a history of ectopic pregnancy and has had one fallopian tube removed. A single fallopian tube removal can lower the chance of a spontaneous pregnancy. This is because there is only one way for the eggs to encounter the sperm. Mrs. Alia might consider artificial treatment, such as intrauterine insemination IUI and in vitro fertilization IVF, to help her overcome this difficulty. IUI and IVF treatment may enhance Mrs. Alia's chances of becoming pregnant. The first current technology that can be used is intrauterine insemination IUI. Sperm is directly inserted into the uterus around the time of ovulation. This technique can be useful if Mr. Harris's sperm count is slightly low but not critically low. Secondly is in vitro fertilization IVF. Involves stimulating Mrs. Alia's ovaries to produce multiple eggs, retrieving the eggs and fertilization them with Mr. Harris's sperm in a laboratory. The fertilized eggs are then transferred to Mrs. Alia's uterus. IVF bypasses the issue of a single fallopian tube and can be highly effective, even with low sperm count. Finally is sperm retrieval techniques. If low sperm volume persists, techniques such as testicular sperm extraction teas may be used.